Right. Hi. Good afternoon, Toastmasters and fellow guests. Art, take it easy on me. This is my first, besides the icebreaker, this is my first speech. So I would enjoy Toastmasters and just give it my best shot. Today, my theme for today is something that I just noticed outside is the U.S. health. I noticed, the U.S. health is probably by far one of the worst health in perspective, like international perspective. I think the U.S. health is probably really down compared to the other nations. So my topic for today is the U.S. health in an international perspective, and this is actually in turn shorter lives and poor health. So we all know that the United States is the wealthiest nation in the world, but by far is one of the unhealthiest. And then, although life expectancy and health have improved over the past century, these gains have lagged behind in other high-income countries. So the health disadvantages prevails, even though the United States spends far more per person on healthcare than any other nation. To gain a better understanding of this problem, I actually read a research paper from the National Institute of Health, the NIH, and they basically investigated the potential reasons for the U.S. health disadvantage. And how was this report conducted? Basically, they did a research on the life expectancy in the U.S., comparing U.S. data with statistics from 16 peer high-income countries, basically the democracies in Western Europe, Australia, Canada, and Japan were included in that survey. And basically what they concluded is that, first of all, how they got their data, I go off of facts and assumptions. I made an assumption that the U.S. is by far the worst in healthcare, but they actually compared analysis and data and statistics from the early 1970s and from the 1990s to the 2008 era. So that's where they received their statistics and facts. So we all know, and from what I've read, we know that the Americans have been dying at a younger age than people in almost die in other countries. This has actually been getting worse over the decades, especially among women. So that's not only are their lives shorter, but Americans have a long-standing pattern of poor health that is strikingly consistent and pervasive over the life course of birth, during childhood and adolescence, and for young and middle-aged adults, and for older adults. So what did they compare to the other nations? And they basically came to the conclusion that as Americans, as a group, we fare worse in 9 health areas, and those areas are number 1 is infant mortality and low birth weight. Number 2 is injuries in homicides. Number 3 is adolescent pregnancy and sexually transmitted infections. Number 4 is HIV and AIDS. Number 5 is drug-related deaths. 6 is obesity and diabetes. 7 is heart disease. 8 is chronic lung disease. And 9 is disability. So they also figured out that the effect of people who live to the age of 50 and those who reach the age of 50 have actually poorer health, and they have greater illness later in life. So, but the Americans do enjoy a few advantages when they compare to the other nations. That included lower cancer death rates and greater controlled blood pressure and cholesterol levels. So if Americans reach the age of 75, they actually found out that they actually live longer than their peer in other countries. So with these exceptions, however, the other high-income countries outrank the U.S. on measures of health. So bottom line is we're lagging behind compared to the other countries. So why are Americans so unhealthy? That's like the million-dollar question. So why are they so unhealthy? There's 4 reasons why. The first one is the health systems. So unlike the peer countries, the U.S. has a relatively large uninsured population and more limited access to primary care. So what does that mean? That means people are having a hard time either going to their doctors because it's so far away, or they don't have means of transportation, or they probably didn't account for the Obamacare this year. So we know that the health system is improving. Number two is healthy behaviors. Although Americans are less likely to smoke and drink alcohol less heavily than the other countries, they actually consume more calories. So that's another major issue. They also have higher rates. Americans have higher rates of drug abuse and are less likely to use seatbelts. For some reason that struck me odd because you always put your seatbelt on. I guess we don't. And we're also involved in more traffic accidents that involve alcohol, and are more likely to use firearms in acts of violence. So that kind of struck me as a major health behavior that I had no idea that Americans do often. And the third one is social and economic conditions. Although the Americans is the highest in the average than any other countries, they also have a higher level of poverty. So especially child poverty, income inequality, and lower rates of social mobility, basically. So the other countries are outpacing the United States in education of young adults, and this also could affect the health of the U.S. And for the long term, this would probably affect the steering. And the last one is the physical environment. You guys notice when you guys go to a different country, everything's so close, it's walking distance. But when you come to the U.S., everything is like miles apart. Even to get to your house is like 20 minutes, 30 minutes away. And that's one of the major issues they see is that in the United States, we just jump in our vehicle and we don't walk as often as we should. So we're human beings. We got legs. We're made to walk and move, but we're just working at our desk, getting in our vehicle, going home, watching TV, sitting on the couch. So we basically sit down all day, unless you're active adult. That's what I try. So I work out and exercise as much as I can because I understand that this is one of the major problems. But in the long run, overall, is that no single factor could fully explain the U.S. health disadvantages. It's a combination of many things, one of the four things that I outlined, but the multiple causes that involve some combination of the four topics that I just talked about. But in conclusion, because I'm running out of time, the lives in the U.S. people we're at stake. This is a problem that we have to really take upon ourselves and try to change and see if we can do something about it, like changing yourself and not falling into this. I'm not going to live up to 75 years old because I'm eating McDonald's every day. So make sure everybody here try to live a healthy lifestyle and be aware that we got major factors contributing to poor health, and that we lag behind the other high-income countries in the world, that we actually need to either do something about it and make a change, because if you don't make a change, no one will. And that's all I have. Thank you.
Thank you. Great speech. Art, I think